And our conversation tonight on Extra Mile, we're talking to the governor for Bomet County, Dr Hillary Barchok, who is already in the studio. Let me introduce him, sir. Thank you very much for joining us tonight.
Thank you, John,
yes,
for giving me an opportunity at least to have some discussion with Kenyans. Yes.
All right. Let's begin with, since Governor Dr Joyce Laboso died in 2019, having campaigned with her in 2017, you were direct from a classroom. And here you are, 1 year or two after your election, the governor is gone, and now you have to take up the leading role. How did you steer Bomet County forward after that sad incident?
Thank you, John. As you have clearly indicated, I came directly from classroom to politics. In fact, I joined the late governor 3 months into the election because I came in, I think it was around May. And the elections was in August. I served with the lead for 2 years, and then she left us. This is something that I was not prepared for, because one, I think in my priorities, joining politics was the least in terms of priorities.
It was the least among
the so many priorities that I had in my life. So I didn't want to join politics. One is the picture that had been painted about the politicians. There is this belief that when you join politics, you become a liar, because you say things that you are not committed to ensuring that you fulfill them. But all the same, I was thrust into politics through the appointment of the late Dr. Joyce Laboso, that she mentored me for close to 2 years. When she left us, of course, it was not very easy fitting into her shoe. This was a great politician. But I want to thank God. In the 2 years that I served with her, all the decisions that we made, we did a lot of consolidation. I was in the picture of everything that was happening in the county. And that made it a bit easier for me to actually continue steering the county to where it is even at the moment. So it was not very easy for me adjusting to the environment that I was now the chief executive officer in charge of the county of Bomet. Taking the new roles of being a governor, adjusting to the political environment, it was not very easy for me. But I want to thank God. Being a teacher sometimes makes you to be very versatile, and that is why I was able to adapt to the new challenges very fast. Yeah. It
is your background in education that helped you to adapt very fast.
Yes. Yeah.
In terms of implementing her vision, because you campaigned together in 2017, that means you had a shared vision for Bomet County. How have you been able to carry forward her aspirations as well as yours, being a joint ticket?
Thank you so much, John. And we campaigned on the platform for change. We wanted to change the lives of our people in Bomet. We had a manifesto that had 7 pillars, and I have not deviated from that manifesto. It cut across all the sectors that we have, from education, health, agriculture, water, infrastructure, and even the governance issues. And that is the Bible that I'm using at the moment to ensure that the vision that the late governor had about Bomet County is achieved. I normally say she has rested, but the vision that she had still lives on, because I've made a commitment to the people of Bomet that I will ensure that we deliver on that promise that we gave to the people of Bomet when we are campaigning. So, and I want to thank the people of Bomet because of the support that they have given to me. The leadership that we have in Bomet, the MPs, the senators, the women rep, the MCAs, all of them have been very supportive. And that's why Bomet has been very quiet. And when the place is quiet, it means there's something that is going on, something good that we are doing at the moment. And I want to tell you that we will deliver on that promise, despite the challenges that we are facing as counties, especially the issues of finances. But I want to thank God that where we were in 2017, there is a lot of improvement, and hopefully in the next 1 year, at least we'll be able to report back to the people when we are going back even to campaign for the 2022 elections. There's something that we will say we have done.
All right.
In the 5
years. And we'll talk about the 2022 general election in a bit. But you've talked about the 7 pillars, the vision that you shared between yourself and Governor Joyce Laboso, the late. And I'm thinking about the health function. Let us square this, I think, once and for all, because much of what you get out here is that people think county governments have been unable to function optimally when it comes to the issue of the health function when it is under county governments. Tell us about the management of the health function and how county governments are faring, bearing in mind that the devolution conference is upcoming.
Thank you. I think one thing that we need to appreciate, and I want to believe this could be the best thing that ever happened to this country, is the devolution. There are things that we've been able to do as counties that we could not imagine that it could be done. There are areas that we have been able to open up, like in infrastructure and so forth. So health is fully developed. Of course, the national government is assisting us in making policies and giving us technical advice. But much of the health has been developed. So we are running that function as county governments. Of course, we have challenges. As much as I want, I'm saying that devolution is the best thing that ever happened to this country. In health, we have been having challenges, especially in the area of infrastructure, in the area of human resource, the technical people that we require even to run. Where we have facilities still, you'll find some counties still having challenges in ensuring that they maximize on those facilities that we have in our facilities. So, but in my own assessment, I think we have done fairly well in terms of our management of health facilities. And ensuring that our people get the best health services that we can afford. Sorry
to cut you short, Governor.
Yes.
You appear to admit there are challenges.
Yeah.
Where are these challenges? Where do they emanate from?
Now, I've pointed out, one, the issue of infrastructure.
Infrastructure.
Yeah, putting in place that infrastructure requires a lot of money. So, and remember, there are competing priorities. We also require medicine for these facilities. So sometimes you weigh putting up those structures and ensuring that you have supplies in our facilities. Which one do you put priority? I mean, prioritize. Of course, people like in my county, we have set and prioritized to have dispensaries in all the sub-locations that we have.
Okay.
When we came in 2017, there were around 36 sub-locations that didn't have dispensaries, but we have since reduced the number because we have set up a number of facilities. But as you set up these facilities, remember, you have to increase the personnel. You have to increase the allocation that will go to these facilities because they have to run these facilities in terms of all those services, that supportive services that they require in a facility, a dispensary. There are issues to do with, of course, wage bill. There is a limit. So sometimes we want to prioritize and have staff within our facilities. But if we overshoot, you'll also miss money for other development in other areas. So we have been having issues to do with infrastructure expansion. We have been having issues to do with personnel, like people working in the radiology departments. Has been a challenge. We have machines in some of the facilities that are lying idle, not because of anything else. But
does that include the ones that were leased by government back in 2014?
Yes, quite a number in some counties. Okay. But I want to say in Bomet, I think we have done fairly well in terms of maximizing those equipments. All of them are in use.
All right.
But generally what I'm saying, as counties, we have faced challenges to do with personnel and infrastructure.
All right.
Yeah.
Marry that with the universal health care, because it was it was cast as, the silver bullet to issues of accessible healthcare and affordable healthcare. And I'm sure it was piloted in 4 counties, and then it was rolled up in the other counties. Tell us how you're faring as county governments in terms of implementation of this vision, and probably some of the challenges that county governments are facing in implementing UHC.
Thank you. That was a noble idea. And as you have said, it was piloted in a number of counties, which include Kisumu, Machakos, and I think the other one was Nyeri and
Isiolo.
Yeah. But of course, in any piloting, there are lessons that we learned. So that's why normally we implement programs or projects in small scale, so that at least you can learn some of the challenges and work on those challenges, so that when you roll out that program or whatever project that you have, it will be a success. Unfortunately, from what was done, I think we didn't document very well some of the challenges that the program faced. And still, the most challenging issue that I think faced that, or is facing that program, is actually the issue of financing. One, there is a large proportion of our people that are living in poverty and they cannot afford health. We have a number that are actually in informal sector. A large percentage are not even enrolled in the NHIF and so forth. We also have a number of people that are dropping out of these insurance programs and so forth, which means we have a lot to do. Now, when it comes to this large proportion of people that are living in poverty and they may not be able to pay for the insurance, it means we have to look for an alternative way of financing that. And this is the challenge that we are facing as counties. Taking an example of Bomet, I think last month, it was the end of last month, we rolled out our program to support 10,000 households by enrolling them in NHIF. So, but when we went around the villages and the 25 wards that we have, there are so many people that are needy. As much as we are talking of 10,000 households, there are others, so many of them that are in need of support. So if we will be able to support these people, and then I think as a country we'll have done a good thing to our people. But sustainability of this program is a challenge, because it means we need to pump in money every year, because to support the 10,000 households, we require 60 million as a county. Now, getting 60 million every year, and as I've mentioned, we have competing priorities. Will it be sustainable? That is a challenge that we have. And probably we need to bring more people on board, and we need to think of a better model of financing our healthcare. Otherwise, it will be a challenge.
All right.
Yeah.
I'm still on healthcare, and I'm thinking about your proximity. First of all, Bomet is in the Lake Region counties, and the country had to close those counties for some time, perhaps even readjust curfew hours. Tell us how Bomet has been able to deal with the surging numbers of COVID-19 in Lake Region counties.
As much as we are talking of Lake Region or LREB region, I think COVID is a challenge all over. We were under lockdown, but I'm happy at least today the president was able to lift that lockdown, especially in LREB region, which has, I think, 14 counties, one of which is Bomet. So there have been a number of challenges associated with COVID-19, and it has affected lives and livelihoods of our people. The economy has been depressed because of that.
Yes.
And that has been a challenge. The reduced number of hours that people are working, yes, affected a number of sectors that we have in the country, from the hotel industries to whatever small-scale businesses that we have within the community that has been supporting the lives of our people. So we have been struggling like any other county that we have in this country. And I think to some extent, I want to say that we are almost adapting to the new norm that we have within the community. Well, of course, a number of businesses have closed down, a number of people have lost their jobs and so forth. But I think we have to live with this COVID. We have to find ways of adapting, because we don't know for how long it will be with us, but we have to adapt.
All right.
Yeah.
All right. When you talk about COVID-19, I was reading a report just the other day. And so there was a commissioning that was done to see how easy it is for county governments to acquire oxygen plants by themselves. And you realize there's quite a number of counties that don't have an oxygen plant. First of all, does Bomet have one?
We do have oxygen plant in Bomet. And has a capacity of producing 9,000 liters per hour.
9,000 liters per hour? 9,000
liters per hour.
Okay.
And this is a very huge volume. For example, Kenyatta, I'm told, uses around 8,000 liters per hour. So, in other words, we are producing an excess of 1,000 liters if we were to supply Kenyatta National Hospital. This is a facility that we installed when we came into the office. We did have a small one that was installed by the first government. But when we came in with the late Dr. Joyce Laboso, we installed this facility. All our beds that we have in Logisa Referral Hospital are piped with oxygen. We are also supplying oxygen to some of our private hospitals that we have in Bomet, like Ablong Mission Hospital. At the moment, we are also assisting some of our neighbors, like Siloam Hospital in Kericho. We are also supplying them with oxygen. We have been also able to support even ambulances that are transporting patients all the way from Nyanza to Nairobi or whichever sides of this country, so long as they have the containers, we normally fill them free of charge. The only thing that we have been insisting is, if we are giving you free of charge, please don't sell it. Or if you have to do it, then it should be subsidized, because we are giving them free of charge, we don't sell. So I'm happy, as much as we are complaining that we don't have oxygen in our facilities, in Bomet we have a lot of oxygen. Even our private hospitals like the NWEC, they also do have oxygen plants. So we have a lot of oxygen in Bomet.
Let's talk about the agriculture sector, because I understand my time is running out. But there's something very interesting. Bomet is now selling tea to Iran? Yes. All right. How did you get that?
Now, we have to be strategic, and the industry has suffered a lot in terms of the prices that our tea has been fetching. And I think if we have to improve on that, then we have to move away from the traditional markets that we have. And this started, I think, somewhere around 2020. Last year, when I visited the embassy of Iran. We had some discussions on looking for opportunities for investment within our county, and even opportunities for our people in Iran. And the area that we narrowed down to was the area of tea. So the ambassador of Iran, Dr. Barchok, visited Bomet. We were able to tour the tea farms, and the small-scale farmers, and even the large-scale farmers. And I was also invited to visit Iran. We toured Iran, and for your information, some people would want to imagine that Iran is a desert. It is not. The upper part of it, they produce a lot of tea. So in a province called Kilan. So we had some chats with the governor of Kilan, and we had even agreed to come up with an MOU so that we can have joint marketing with that province, now being a friend of Bomet. We drafted an MOU, which we have processed. It has gone through the Ministry of Devolution. Now it has been lying in the Ministry of Foreign Affairs for the last 9 months. So we have not been given that support by I want to say the national government, so that to ensure that we effect that MOU. But all the same, that did not prevent us from moving on with the plan that we have to improve the prices of tea, the earnings that comes to our farmers. So through our discussion and the network that we developed in Iran, we have been able to do the first shipment to Iran. And this was a direct sales from one of our private factories to buyers in
How many
Iran.
kilos, how many tons?
Yeah, we were able to sell 84 tons
84.
for a start.
Okay.
Yeah, and in fact, we are planning to go to Iran, wait not for their elections and swearing in of the president and the lockdown that followed after the swearing in of the new president that was on 5th of this month. But we still have plans, although they have extended the lockdown to next week, but we have plans to visit Iran and follow our tea and demonstrate that this thing is possible, so long as we have commitment. Yeah, and they are fetching good prices, by the way. I don't want to mention. I don't want to mention it here, but good prices for our tea.
All right, got interesting.
Yeah.
Governor, I understand I'm running out of time, and I've been asked to wind up this interview. But before we do, are you going to seek re-election as the governor of Bomet County?
Yes. Of course, I have to serve full term to ensure that we fulfill on the promise that we had given to the people of Bomet. So 5 years is not enough. We require at least 10 years to at least do 90 or close to 99% of the promise that we had given to the people of Bomet. So next year, as we prepare, I'm also preparing for myself for a comeback.
And you're confident you're going to be the likes of Plogom?
Why not?
Kira Isaac Ruta.
Our development record speaks for itself.
All right.
So if people are interested in development, Barchok is the man.
All right.
Yeah.
If you're interested in development, Barchok is the man. Thank you very much, Governor.
Thank you so much
for honoring us and coming tonight. And fantastic job you're doing. Wish you God's grace again as you continue with your job and serving the people of Bomet. That's why we wind up Extra Mile. Cindy Jama is up next with the business. Don't go too far.